So you've just had your lower blepharoplasty pinch done here with us at Visage. So I'm just going to go over those post-op care instructions with you. We're going to give you a care kit to take home. So in there, you're going to have some ice packs and some Aquaphor. The ice packs are going to be used to help with any swelling that you may have. So the swelling is going to peak generally around the first 24 to 36 hours after your procedure with us. So with the ice packs, you can just wrap them in a cloth or some sort of barrier so it isn't directly touching the skin. And then icing for 15 minutes on, 30 minutes off, and just repeating this as needed for those first few days of healing to help with any swelling. To also help with swelling, you can sleep elevated with a few pillows, 30 to 45 degree angle for that first 5 to 7 days after your procedure. You will have sutures non-dissolvable under your eyes. Those are going to stay in for roughly 7 days. So at your 7-day follow-up is when we'll remove the sutures. After 24 hours, you can start showering, just making sure the water isn't directly hitting where those sutures are, and making sure that your shower is lukewarm, nothing that's too hot or with steam, as this will increase your swelling. Making sure as well not to soak the area for at least 4 weeks. So no swimming, no saunas, no baths, unless otherwise directed. After 48 hours is when you can start cleaning the area with a mild non-scented soap and warm water. And then you're going to apply that Aquaphor ointment twice a day to the incision line just under the eye with a nice thin layer, and doing that until your 1 week follow-up. And then we'll discuss from there the aftercare at that point. For pain, so you can take anything that we may have prescribed to you for pain, just taking this as prescribed as needed. Otherwise, Tylenol or Tylenol Extra Strength are also great options. We just ask that you avoid any non-steroidal anti-inflammatory drugs like Advil or naproxen for the first 5 to 7 days, as these can increase your bruising or your bleeding. Things to look out for are going to be signs of infection, such as pus coming from the site, any foul-smelling odor, and increased redness, tenderness, any abnormal swelling around the area. These are all things that we want you to let us know about so we can tackle that as soon as possible. So during our regular hours, you can contact our front desk. In the evenings and on the weekends, one of our providers would have given you their contact information, so please feel free to reach out to them if you do need to at these times. If you happen to go to the emergency room for any reasons not related to your procedure with us here within the first 14 days after your procedure, please just make sure that whenever you get a chance, you give us a call and let us know. And that way we can just stay up to date on your health. Thanks for choosing us for your procedure, and happy healing.